It was in 2007, December. So I went to the emergency room and they did some tests and admitted me. And then a couple days later they did a biopsy and confirmed it was lung cancer. I thought it was the best. It pinpoints just where the cancer's at, where you don't have it all over. And I've talked to the doctors and I thought that was my best option. I asked many, many questions. All my questions was answered. They made me feel real comfortable with the CyberKnife and real friendly. I would come in and when I'd leave, I'd do what I did every day. If I wanted to go grocery shopping or a movie or whatever, I had no side effects. The CyberKnife was, I didn't get sick. I had no side effects whatsoever. I listened to whatever music I wanted to. They, had country or rock and roll, and they would put the radio on it. And I laid there, and the machine went around me and did, what it was supposed to, and it was, a pleasant experience.
Miss Fulton came to me actually with a recurrence of her cancer. She initially was diagnosed with an early lung cancer and had surgery. Unfortunately, we know that an operation is not always curative in that situation, and she had a very aggressive treatment. Unfortunately, she developed a recurrence near the area where the original tumor was. We have a unique program here where we integrate something called navigational bronchoscopy, which is a GPS system of the body where one of our pulmonologists can actually navigate through the breathing tubes in a minimally invasive way to go in there and biopsy this tumor to establish the diagnosis. And so we knew that her cancer had come back. The other unique thing is at the same time, we can put in something called a fiducial marker, which allows us to track the motion of these tumors very well on the CyberKnife machine. And so that's really how she came to be diagnosed and meet me for the first time. Her tumor was very close to a lot of critical structures in her lung, the breathing tubes, the swallowing tubes, and near an area that had already been kind of compromised from her previous cancer. So CyberKnife allowed us to use pinpoint radiation directly to the tumor while minimizing dose to these other important organs in her body. I mean, really what we wanted to do was offer her a chance at cure, but let her remain functional and do the things that she wants to do.
I've got quite a few grandchildren, and I was limited on going to their sports events and stuff. I've got 2 granddaughters that's in swimming, and I can go to their swim meets now, and basketball games and outings with the family, and I can stay longer. I don't get so wore out, and all chemo really wears you out. So the CyberKnife, I had no problem with it. I could, like I said, I could go that day and spend quite a long time. It's like a routine checkup at the doctor's office is about what it's like.